What do you think of when you imagine an American living in exile, unable to return to the U.S.?
Criminal,
Tax evader,
draft dodger,
terrorist threat? Do you think of me?
do you think of me?
So I was living in California and I met my husband through some mutual friends, and we fell in love and decided to get married. There was only one small problem. He was Canadian. So we flipped a coin and we decided to live in Canada first. And here I am in beautiful British Columbia.
I'm originally from California, born in Los Angeles, grew up in Palo Alto. And I came to Canada in 1975 with my husband and my youngest daughter because he had been offered a fellowship at the University of British Columbia.
When our son Sam turned 4, around the time he turned 4, he developed a rash on his body and he started to complain about his bones hurting. So we sent him to a dermatologist for the rash and a pediatrician for muscle weakness. And after some initial appointments, a dermatologist told us she suspected he had this rare skin and muscle disease called dermatomyositis. Without proper treatment, a third of children with dermatomyositis will die, and a third will be severely handicapped.
I was teaching in Nanaimo, and I started having bleeding from the intestines, and it turned out to be a very, very rare autoimmune disorder, acquired type von Willebrand's, which nobody seems to know much about.
After she diagnosed him, it was only 6 days later when we were at Children's Hospital and they admitted us immediately. He had 4 days of intravenous steroid treatments, and we've spent the past 2 years, he's 6 years old now, slowly weaning him off of his medication while monitoring any disease activity.
So I had to retire early when I was 60. And from that point on, it has never been possible for me to go back to California because I knew I could never be covered by insurance there.
When Sam was first diagnosed, my friends in the States had one of two reactions. They either said, "Oh, are you coming down here for treatments?" Or they said, "Can you afford this?" And to me, both of those things seemed ridiculous. We've had amazing care in Canada. He has a team of pediatric rheumatologists that are world-renowned, and the costs have been a non-issue. We simply pay our monthly payment of $108 a month, and we march in. We don't fill in any paperwork for him to see the doctors, and it's all good.
There is something that was discovered fairly recently called Factor VII, and time before last, when I was in the hospital here, they gave me that, and it seemed to work. The interesting thing is that the Factor VII, I don't know exactly because I never get a bill for anything, but I was told that it was about $60,000 a dose, and I was given 4 or 5 doses in the hospital. And the interesting thing to me is that I have never been told that I couldn't receive a treatment here because of the cost of it. I don't even know the cost of these things.
When I was researching the costs of healthcare in the U.S., I asked some other Americans on a message board about his disease, what the costs have been to them. And that's when I discovered that our out-of-pocket costs for care would be between $45,000 and $165,000 for 6 months of treatment. I realize I have no idea what the costs have been in Canada for his treatment because we've never seen a bill.
Yeah, I would like to spend whatever time I have left, my remaining years, closer to my children and grandchildren. And I certainly can't do that under the circumstances with the present healthcare situation in the U.S.?
I'm interested in moving back to the U.S. because I miss my family and I want my child to be raised near his grandparents and his aunts and uncles. And I also just miss my country. I began to investigate what it would take to move back to the States, and I immediately thought of healthcare as a concern because of Sam. And I called a number of private insurance companies and was told outright that we would be denied coverage based on his pre-existing condition. I then looked into what government programs were available, and the S-CHIP program has an income cap of $45,000 a year, and we exceed that.
So what I have is disability Social Security. And they wrote me a letter and said, don't ever bother to apply for Medicare because you are not eligible.
I worry if my mom's cancer came back, I couldn't go down there and care for her and see her live out her final days.
As an American citizen, it seems to me that I should have a right to spend my last remaining years back in my home country with my children and grandchildren.
Living in a country which has universal coverage, I've experienced both systems, and the system in the U.S. is not fair for middle-income people or for low-income people.
I'm just going to be extremely disappointed in the American system and the way that it works, and the people in Congress.
To me, healthcare, it's a human right. It's not a privilege.